Hello, I'm Dr. Russell Homan of Canopy Pediatrics. I'm both a board-certified pediatrician and lactation consultant, and today we're going to review the proper way to wash your hands. So I'm not only going to talk about how to wash your hands, I'm going to talk about when you should wash your hands, and also we're going to talk a little bit about how and when to use hand sanitizer. And these guidelines that I'm discussing with you are those suggested by the Center for Disease Control. And now we're still in the middle of flu season, but the coronavirus outbreak is among us, some of us at least, or is coming to Tallahassee in the near few weeks. So I think this is very important that you guys remind yourselves the proper way to wash your hands. So first, when do you wash your hands? I think the most obvious thing is after you go to the bathroom. Everyone knows that. But also, anytime you are dealing with any human or animal waste. So say you're the mother of a toddler, anytime you change the diaper, you should wash your hands. Most of us probably know that. Also, anytime you take your dogs out for a walk and they go potty, or anytime you're dealing with animals, you should also wash your hands. Some other times you should wash your hands that we all do a good job on is before you eat, you should wash your hands. But what about preparing food? So anytime you prepare food, you should wash your hands before or afterwards. I think we all know that bacteria like salmonella live on top of raw chicken, and other raw foods have bacteria as well. So other times you should wash your hands are before taking out the trash. That one's kind of obvious. A couple more are anytime you're injured or someone's injured and you have to help someone with a scrape or a little cut, you should wash your hands. And another one would be, say you're sick, you're at home, especially if you're living with people, it'd be great if you washed your hands almost every time you could remember, every hour or so. Because, you know, you're rubbing your nose, you're blowing your nose, you're getting a little mucus on your hands, and you don't want other people you live with to get sick. And, you know, hand washing is so important because these viruses and bacteria can enter our body mainly through our eyes, through our mouth, and sometimes we breathe them in our nose. And usually we get them by touching something that's dirty and then rubbing our eyes or getting it on our food or touching our own mouth. All right, now let's move on to how you should wash your hands. So the CDC says you should turn the water on, get your hands completely wet, then turn the water off, and get plenty of soap to get a good soapy lather like this. And remember to get in between your fingertips, pretend like you're a surgeon, get in between your fingertips and get the backs of your hands, the back of in between your fingertips as well, and then under your nails, which is going to be easier for a lot of people that don't have long nails. So rub under your nails. My favorite way is just to kind of angle your nails like this on the palm of your hands and rub them down like that. Some people may need to use the side of a finger and get their nails. And then the other thing not to forget is how long to do it. Studies have shown that 15 seconds to 30 seconds seems to be about right. So the CDC just went with 20 seconds. And that is also how long it takes you to sing happy birthday 2 times. And not turbo happy birthday for those of you out there. Just like a regular old happy birthday to you. Happy birthday to you. Happy birthday, dear Dr. Homan. Though it's not for another few months. Happy birthday to you. All right, so now you just rinse off the lather. Got it off really well. Then turn off the knob. I know a lot of us really worry about touching the knob, but the CDC says there's no research that germs are transferred from the knob. And then try to grab a clean towel because wet hands pick up germs more than dry hands. So dry your hands off really well with a dry towel. And then just throw the towel in the trash. If I'm in a public place or there's a door handle, I usually will use the towel to open the door and then throw the paper towel away after I've opened the door. All right. So say you don't have soap, the next best thing to use is hand sanitizer. And it's important that the hand sanitizer is 60% alcohol or greater. The one I have today, Purell, is 70%. And then how much should you use? Usually one pump. You want about half a teaspoon. That's not very much of hand sanitizer. So similarly, get a pump that looks to be about half a teaspoon, rub it together, and then you want to rub for about 20 seconds again, and you want it to seep and dry on its own. Don't do this for 5 seconds, get a towel and dry it off. You want to dry it completely off. All right, I'm getting pretty dry. That's pretty good. So again, thank you. It is very important during this flu season outbreak, and if the coronavirus does come to Tallahassee, that we are all washing our hands very well. Again, this is Dr. Homan. I have my practice, Canopy Pediatrics. You can check me out at canopypediatrics.com. I'm off Capitol Circle Northeast next to Ted's Montana Grill. Thank you.